My name is Destiny. I'm a student nurse at Orvis. Today I will be performing a health assessment on you today, okay?
Okay.
Now that does involve some touching, some inspection, testing your range of motion and your strength. Is that okay?
Yeah.
Do you mind showing me your wristband and telling me your name and your date of birth?
Ricardo Moreno, November 11th, 1995.
Okay. Any allergies?
No.
Okay, thank you. Alright, so we have a 24-year-old male sitting upright, no signs of discomfort or pain. He appears to be alert and oriented, no labored breathing noted, and no obvious pulsations. So at any point in time, if you feel discomfort or pain during the assessment, please let me know, okay?
Okay.
Now before we begin the assessment, I have a few questions for you, alright?
Mm-hmm.
So tell me, do you use any sunscreen?
Yeah, daily.
Okay, good, good. Have you noticed any abnormalities with your moles or any new moles?
No.
Okay. Have you been experiencing any shortness of breath?
No.
Do you smoke?
No.
Okay. Have you ever been diagnosed with hypertension, hyperlipidemia, or diabetes?
No.
Any family medical history of heart disease?
No.
Okay. Have you been experiencing any nausea, vomiting, diarrhea?
No.
Okay. Do you have a history of bone fractures?
No.
Okay. What about any seizures or convulsions?
No.
Okay. Now, do you drink any alcohol?
No.
Okay. And do you take any over-the-counter meds or any medication in general?
No.
Okay, thank you. So now we will be beginning the assessment, okay?
Mm-hmm.
Alright, so first I'm going to test the facial nerve 7. Can I have you raise your eyebrows for me? Can I have you wrinkle your forehead? Okay. Can I have you puff out your cheeks? Can I have you smile and frown? Good. So your facial nerve 7 appears to be intact. Nice. I'm now going to inspect the mouth. I see that your lips are symmetrical. They're pink and smooth textured. I'm now going to shine a light in your mouth, so open wide as best as you can, okay?
Okay.
Say ah. Ah. Thank you. And do you mind moving your tongue left and right for me, please? Good. So your cranial nerve 12, hypoglossal nerve appears to be intact as well, okay? With full range of motion. So I see that your tongue is pink with papillae present. All your dentures appear to be intact. No gingivitis noted. No cavities noted. Your gums are pink and moist as well. And so is your mucosa. It's pink and moist. And your soft and hard palate are pink and moist. And your soft palate is raised in midline. So good. I'm also going to give your tonsils a +1 grade. And yeah. Alright, so now I'm going to be assessing your eyes, okay?
Okay.
Alright, so I see that your sclera is white and your conjunctivate is clear and no discharge noted. I'm now going to shine a light in your eyes. Do your best to not look in the light. So you can look at my forehead, my ears, my shoulders, whichever suits you best, okay?
Mm-hmm.
Just don't look at the light. Can I have you look straight ahead?
Mm-hmm.
Now follow my finger. Good. Okay, so I see that your pupils are 4 millimeters in diameter. They are round and equal and reactive to light and accommodation, which is good. So I'm going to note that your oculomotor nerve 3 appears to be intact, okay? Now, I'm going to test your oculomotor nerve 3 again, along with your cranial nerves 4 and 6, trochlear and abducens. For this, I need you to just follow this pin with just your eyes, so do not move your head, okay?
Okay.
Good. Okay, so I'm going to note that your cranial nerves 3, 4, and 6 appear to be intact, okay? I saw that your eyes were rhythmic, they were smooth, They were parallel, no nystagmus noted, which is good, okay?
Mhm.
So now we are going to move over to the cardiovascular assessment, okay?
Okay.
So for this, I'm going to listen to your heart in 5 areas, okay?
Okay.
Okay, so I'm first going to listen to the aortic area and the right sternal border, second intercostal space.
Mhm.
Okay, so S2 is louder than S1, no extra heart sounds or murmurs noted. Moving on to the pulmonic area, which is the right sternal border, I'm sorry, left sternal border on the second intercostal space. Okay. Now, I see that, well, I heard that there, the S2 is louder than the S1, no extra heart sounds or murmurs. Moving on to the Erb's point, third intercostal space. Good. S2 and S1 are equal, no extra heart sounds or murmurs. Moving over to the tricuspid, fourth intercostal space. Okay. Now this one has S1 louder than S2. No extra heart sounds or murmurs. Moving over to the mitral valve, fifth intercostal space. Good. So S1 is louder than S2 as well. No extra heart sounds or murmurs noted in either of the areas, and regular rate and rhythm in all of the areas. Good. So now I'm going to assess your upper extremities, okay? So can you hold them out for me, please? I'm first going to inspect. Okay, upon inspection, I see that your upper extremities are symmetrical bilaterally, no erythema noted. I'm now going to palpate, okay?
Mhm.
Any pain?
No.
Okay. No tenderness noted. I'm now going to test for temperature. Okay. Skin is dry and warm to the touch as well, which is good. I also see that the skin pigmentation appears to be uniform throughout. Checking for edema now. Good. No edema noted. I'm now going to check the capillary refill. Capillary refill within 2 seconds. Good. No clubbing noted. And now I am going to, can you flip over your hands for me?
Mhm.
I am now going to test for your radial pulse, okay? Okay, I'm gonna give that a 2+, okay? Regular rate and rhythm. Good. Okay, so now I'm going to do the same thing on your lower extremities, okay?
Mhm.
So first I'm going to inspect. Upon inspection, I see that your lower extremities are symmetrical bilaterally. No erythema, no abrasions, no lesions noted. Okay, I'm going to palpate. Any pain?
No.
Okay. No tenderness noted. The muscle tone appears to be symmetrical bilaterally. Checking for edema. No edema noted. Good. Okay, and now checking for temperature. Okay, good. So skin is dry and warm to the touch. Now I am going to check the capillary refill on the toes. Good, capillary refill within 2 seconds. I am now going to check your dorsalis pedis pulse. I'm going to give this one a +1, okay? With
Mhm.
regular rate and rhythm. Whew. Okay, so now I am going to move over to the respiratory assessment, okay?
Okay.
Alright, so I'm first going to inspect the chest. I see that the chest is, do you mind sitting up straight for me, please?
Mhm.
The chest is symmetrical, skin is intact, No abrasions or lesions noted. Good. Do you mind lifting up your left arm for me? Checking for AP to transverse diameter. Good. So I'm going to give that a 1-to-2 ratio, which is expected. So that's good. All right. So now I'm going to listen to your lung in the front, well, your lungs in the front and in the back, okay? First, I'm going to do the front. So every time you feel the stethoscope on your skin, I need you to take a deep breath in and out of your mouth, okay?
Okay.
Good. So, no adventitious breath sounds heard, such as crackles, wheezing, bronchi. So that's good. So lungs are clear to auscultation. I'm now going to do the same thing on your back. So do you mind turning your back to the camera? Okay. So any time you feel the stethoscope on your skin, I need you to take a deep breath in and out of your mouth, okay?
Okay.
Okay. Can you lift up your right arm for me? Thank you so much. Okay. So sounds were as expected in your vesicular and your bronchofascicular areas. No adventitious breath sounds heard as well, like I said before, like bronchi, wheezes, etc. Okay?
Okay.
So lungs are clear to auscultation. Good. So that concludes cardiopulmonary assessment. We are now going to move on to the abdominal portion, okay?
Okay.
Okay, so upon inspection of the abdomen, I see that it is slightly round. It is uniform in pigment, no obvious masses, and no hernias present, and also no scarring or lesions. I am now going to listen for vowel sounds. Good. So normal active vowel sounds in all of the quadrants. If I wasn't able to hear any vowel sounds, I would have to listen in each quadrant for 5 minutes, so a total of 20 minutes each. Next, I am going to listen for bruits. First, I'm going to listen in the aorta area. Okay. Now I'm going to listen in the renal areas. Now I'm going to listen in the iliac. Okay. No bruits noted, which is good. Next, I am going to palpate. First, I'm going to do a light palpation, and then I'm going to do a deeper palpation. If you feel any pain, please let me know, okay?
Okay.
Any pain?
Nope.
Okay. Now I'm going to go deeper, okay?
Mm-hmm.
Any pain?
No.
Okay, good. All right, so no tenderness noted, no masses were noted, and No, the liver and the spleen were non-palpable. And that concludes the abdominal assessment. Okay, so we're gonna test some ranges of motion for you, okay?
Mm-hmm.
So can I have you flex your shoulder, extend your shoulders? Can I have you abduct your shoulders and then adduct? Good. Now can I have you externally rotate,
Mm-hmm.
internally rotate? Good job. Now can I have you flex your wrists, your elbows, and then extend your elbows? Now can I have you flex your wrists, extend your wrists, and then stretch out your fingers as best as you can and then put them in a fist. Good. Now we're going to test the range of motion in your lower extremities. Can I have you flex your hip and then extend?
Mm-hmm.
Both legs, please. Okay. Now can I have you abduct and then adduct both legs? Good. Now can I have you externally rotate and then internally rotate? Can I have you flex your knee? Extend your knees on both? Good. Now can I have you adduct and then abduct? Good. Can you do an inversion and then an eversion? Thank you. Now can you do a dorsiflexion and then a plantar flexion on both? Good job. Okay. So now we are going to test your strength. Okay?
Okay.
So for this, can I have you have your arms out for me, please? You have to go against the resistance of my hands, okay?
Okay.
Good. Have your arms out in front of you. Can you flex? Good. Now, can you do the flex with your wrists? Good. And now, can you try to, yeah, there you go. And don't let your fingers touch, okay?
Okay.
Good job. Now, can you hold on to, squeeze as hard as you can. Good. So I'm going to give your upper extremities a 5 out of 5 bilaterally, okay?
Okay.
Good. Next, we're going to test your strength on your lower extremities. For this, I'm going to have you sit down.
Mm-hmm.
So can I have you try to raise this leg? Okay. Now I'm going to try to push down now.
Mm-hmm.
Okay, other leg. Good. Now can you try to spread your legs? Okay, now try to close them. Good job. Excellent. Now can you flex your knee? Okay, your other knee. Good job. All right, so now can you do a dorsiflexion? There you go. Thank you. So I'm going to give that a 5 out of 5 bilaterally for your lower extremities as well, okay?
Okay.
So that concludes my assessment. Do you have any questions for me?
No?
Okay, thank you.